welcome and to this afternoon where I'm going to speak about Saniona. We are a clinical stage biopharmaceutical company. We are focused on neurological and psychiatric diseases. And this year, November, we signed a significant collaboration agreement, $610 million in milestones plus royalties. We got $28 million up front, and that was a transforming event for Saniona. Today I will speak a little bit about what has happened over the last 2-3 years in Saniona, and also about our pipeline and the strategy for the next 3 years. So let's get started. There are some forward-looking statements in this presentation. I need to take reservation for this. So very short, we have not had much money in the bank the last 3 years. That limit what we could do in clinical development. But still, we have done quite a lot. And we have made 3 deals in this period. And to Swedish standard, that's a lot. Then we have selected 3 new compounds. And so our scientists have really delivered. And I can tell you, each of those, there are 200 man years behind it over the years. So it's quite amazing. It's not something we can repeat easily. And then also on development front, we have some tailwind. We got a favorable opinion for the approval of presentera for obesity in Mexico during the period, and now we are in the final registration process. And then we also have some readouts for one of our compounds. When on the right you have a little bit about the situation in the company as it looks today. We have a share price about 660. I think it's went up 10% today. And the market cap is in the range of 700 to 800 million Swedish. And it has been repressed for a while because we have a TO4 outstanding, and you are welcome to participate. If you have them, you should remember it. But you can also buy them in the market. And there will be a discount of 30% to the share price in this period from 28th of February to the 13th of March. And then the subscription period starts on the 18th of March and will end on 1st of April. And if you're interested, then it's now. It's probably the last time we're going to make any of this type of financing. It's up to me. We have quite strong financial position. We have, at the end of year, 300 million crowns in the bank. And a total balance of about 340. And we are quite lean operation, 22 people, 5 in general administration, and then 17 in research, primarily. And they're all funded through our research collaborations. So we get from each FTE we have on a program, we get between 250,000 euros up to, 275,000 euros up to $350,000 per employee we have on a program. So it is fully loaded cost. And then there will be some extension now because we have some plan to put in staff into pre- and clinical development, but that will be the development side. So some highlights of the company. So we have a very broad pipeline. We are advancing 3 programs now internally, and then we have several partnerships. 2 strategic clinical development collaborations, one for Aktier and then one with Medics where they are developing presentera for obesity. And this is the most advanced product which is now under regulatory approval and could be, we hope, be registered this year. It has to. We've been waiting for a long time, and I believe certainly it's going to happen this year. Something we will at least get a clarification. Then we have a validated drug discovery platform. We have made a lot of money on this. We have made many collaboration agreements on that platform for the years. We have 3 ongoing. And it's fully financed right now, but sometimes we would like some other people, our own people, because we have some projects we really want to get started with also ourselves. So we have a strong financial position. With the cash we have at bank, then we may get another 100 million now in the TO4, and then we have a $10 million milestones, which we're quite certain about we'll get next year, when our partner starts phase 2 studies. And then a potential royalty income on tesofensine in the coming years. And also some milestones payments from our ongoing research collaborations, and we are still working on deals. So these are the near-term revenue streams. And I think we are back to the business model we have been following for many years. We had a period where for 2.5 years, 3 years, we were trying to get to US and go all the way to market, and that was a costly experience. We spent 875 million crowns in this period. And if you take away that, we have made a profit the other periods, while we have built our pipeline. And we've done that through partnerships, and then built the pipeline besides that. And this is what we are back to. So here you see the pipeline. The yellow programs are programs we are advancing internally. The dark blue are partnered programs, and the light blue are positioned for partnering because there is a misalignment to our focus within neurology and psychiatric diseases. And so then we want to sell. If you look at, I will come back to them, but our internal pipeline is focused on epilepsy right now, and also we have a program for depression. Then we have the dark blue, also if you look at the partner programs, we have tesofensine for obesity, which is on a regulatory approval in US. Then we got ACP-711 is now called, for Acadia, for essential tremor. And then we have 3 research collaborations, Astronautics for Alzheimer's diseases, and schizophrenia, Boehringer Ingelheim for schizophrenia. And then we have a joint venture, which we got financed in January, for migraine. And we are doing all the work for them also. So this is backed now by 2 venture firms, AbbVie, which is the market leader worldwide in migraine, and then a French venture capital firm. So internal pipeline, we have 4 assets in the internal pipeline, and we are planning to progress at least 3 of those into preclinical now, and then with the aim of having them ready for start of phase 2 clinical studies within the next 2 to 3 years. And we are funding for that. So SAN2355 is positioned for epilepsy. It also has some other indication, as you can see here. And it's potentially quite valuable program. There are 2 programs ahead of us within this space, and they are in phase 2 and phase 3. And financial analysts in US put a value tag on those programs of $2 and $3 billion respectively. And we think that our compound has the potential to become best in class. It's much more selective. It goes for the right targets. We avoid the side effects, dose-limiting side effects. That's what we believe. And this is what we could potentially see already when we have done the phase 1 study in this period. Because if we, in this phase 1 study, can go up in higher doses than our competitors, and is still well tolerated, then it has then we can show that it has a differentiation, and that we can get much more effective product and also a better tolerated product. Then you have 2219. This is also positioned for epilepsy. It's a different mode of action. It's a potential first in class for treatment of various types of epilepsies. We have strong data from animal models. It's based on a well-known concept, but it's much more selective than previous products. And we have great expectation for that compound too. Then we have SAN2465. It was a program which came out of, we have had several collaborations on this. Last one was Boehringer Ingelheim, a high quality compound. It was developed by Boehringer Ingelheim for schizophrenia. but Roche had a failure of a similar compound, so it gave it back to us. They lost interest. And now we have got some very strong, interesting data in depression, the most validated animal models for depression, where we measure anhedonia. This means patients seeking behavior for pleasure, and anxiety and cognition. And we have positive readout of all three. And it works just as fast as a product called esketamine, and also which is today used in hospitals to help patients if nothing else work. The problem with this drug is that it was 50, 70 years old. It caused a lot of side effects, including you could say reduction in respiratory systems, and people can drown when they take it. So it needs, and then it also have some abuse liabilities. So it needs to be given in hospitals only for 2 weeks. And so it's a highly problematic product. But this one goes in the same pathway, and we see it just the same efficacy. And but as opposed to esketamine, then it is expressed. It is only working on receptors which are found in the limbic system, which controls our mind. And we know that it is a very safe concept for other products been in there in the clinics in the past. So we have great expectation for this product also. And then they have a GABA program more. It has a similar mode of action to 2219. Can also be used in epilepsy. It has a different profile, so it means that it could be even more effective, but it also comes with some additional side effects. And what we are thinking about this is to go to some epilepsy patients who are really severe epilepsies, and also some pediatric syndromes, which is very difficult to treat, where we could use this compound. And we're still working on that. But the three of them, the top three here, are those we are planning right now to start preclinical development on, and then go into phase 1. And we will be able with one of them at the end of 26, this year, and then start phase 1 there, and then we have the data 1 year later. And the 2 others will be ready during the first half of 26. So to Acadia, which we announced in November, so they got worldwide license to the compound we used to call SAN711. Now it's called ACP SAN711, and it's currently in phase 1. And the first indication they will go for is essential tremor. So this is where elderly people start having shaking hands typically. And there's quite a lot of patients of those. There has been no innovation for 30 years, so it's wide open. There is one product, I can't even pronounce it, I think, which is in phase 3 from Praxis, and it has a price tag, peak sales of 1.7 billion, and an NPV of, you can see here, on 1.9 billion by a financial analyst. This one doesn't exist any longer. On Monday this week, Praxis announced that it failed its phase 3. So now there's nothing ahead of them. And this is what they go for to start with. There are also other indications. We wanted to take this to childhood epilepsies. And Acadia is also interested in this, but there are more patients here, and this was value driver. And as you can see, we got $28 million up front. Then we are entitled to $10 million when they start the phase 2 study. We are helping them right now doing this, and they pay for it. So we are not putting more money into this. They are even refunding a study we did last year. Then also we will have additional milestones, as you can see, as they go along. And then we will have mid-single digits to low double-digit royalties on product sales. So it's a good deal. It was probably one of the 10 biggest deals in Sweden so far. And certainly also a good deal for a phase 1 product. Then a little bit of tesofensine, which was under regulatory approval. So Medix oversees the clinical studies, the regulatory agency and the commercialization. And they have the right to commercialize the product in Mexico and Argentina. We have obtained, we will get royalties on this, mid-teen royalties on their sales in Mexico. And then we have the right to the product in the rest of the world. And so this is an interesting deal because we take advantage of their regular local expertise and their access to the market in Mexico and Argentina, and while at the same time we control the world market, the rest of the market. And here we need to do some thinking once the product is approved, and which we expect to happen this year. So what are we going to do? We take a stepwise process on this. So first of all, the first year we focus on getting this product on the market, and so we start getting royalty income from this product. And then the next logical step is to go to other countries in South America, because the South American countries, they use Mexico as a reference country. So we don't need approval in Europe or US before they will go for registered in the other South American countries. We also have, and there are some big markets there. Brazil is a very large, $1 billion market in obesity right now. Then also we have the potential to go to South Korea. They also have a big pharma industry and also are ready to register program themselves. But we need first to find a partner to do a bridge study in South Korea. And we have been out there a couple of times and seen some good interest in this once we have the product approved in Mexico. So this is the second step. And then the market in obesity has exploded. 7 years ago, it was a $1 billion market worldwide. Now it's going to be more than $100 billion, thanks to the success of GLP-1 analogs. And they're extremely good, GLP-1 analogs. But this one provides the same weight loss as Wegovy, as you probably have heard about. It comes in a tablet. And it doesn't have the same side effect profile as Wegovy and the GLP-1 analogs. And it also has certain other advantages. So we need to think about how we could position in the US and Europe, and particularly in the US, which is the most interesting part. We have done a lot of thinking about this, and we have some ideas. We need to file some patents. This is an old compound, and we need to solve that. And then we need to take end of phase 2B meeting, and with those two components, we need to go out to a partner, because the phase 3 study in Mexico will not qualify for registration in the US. Here we are talking about 2 phase 3 studies, a total of 1,800 patients, probably in the range of $200 million. So we need to find a partner to do this. But first we need to build a business case around it. So these are the 3 steps about tisofensin. And maybe it's something we should put up in subsidiary and do something in a different way going forward, because it doesn't really fit into our neuroscience focus right now. But we have the asset. So what is the strategy for the next 3 years? So we are going to build value into our pipeline in order to enhance our opportunities. And so we are taking money we got from Acadia and the milestones, and also the 100 million hopefully we get in now, and we will then invest in these 3 early assets and bring them ready to phase 2. And then there is one obvious option for us at that time. It is we're going to replicate the deal again with one of them, with the Acadia deal, and get in cash and bring them through the other 2 through phase 2. That is an option. There's also potential when you have 3 products in the same space that somebody would be very interested in this company. And then third is that of course we could go out to institutional investors and get a chunk of money in, so we don't go into these right issues again, which I think is destroying companies right now. Then we have our research platform, and we have 3 ongoing collaborations, and we're going to maximize the value of this to keep our research funded, and then also get some milestones in our earlier stage research programs. And so the objective for us is to stay away from right issues. I don't want to do any more of this, and secure funding through our business development activities, and then also getting royalties from tisofensin for obesity, and then develop the company on that. And then we are also on the EI, investor relations side. We will go out on conferences like this one, much more than we have done in the last 3 years, and also go to roadshows and institutional investors. So, what happens in the coming year? We are starting up the programs now, and we will put out press releases when each program, and then we set some time estimate when we expect we are ready for phase 1. And we have already done this process. And then we have the result from the TO4 coming out here 1st of April. And after that, there's a key milestone is the potential approval to Stefanson in Mexico. Then we have potential also candidate selection either from Nordics or for Ingelheim during the year, which will provide a milestone payment to Saniona. And then by the end of year, we will have the first asset ready to start a phase 1 and clinical trials. So a preclinical development typically takes an 18-month period. This one we worked on already last year, and we only have 9 months left on that to do that. So we only need to do the GLP studies, and then we are there. The second one are a little bit behind, and the third one is a little bit further behind. And then also, we still working on business development. We always do this. I like to work on programs which I know I can sell. Some of these assets I showed you before, our internal assets, I know I can sell them already today. But I want to build more value and to get a better, richer deal out of it. We learn a lot when we speak with potential partners of what to do with the asset and what one is interesting. And funny enough, what we think is interesting, our partners, potential partners, do the same. Okay, so this is what I have today, I believe. Okay. Yeah, sure.
You can take that one.
Okay.
Yep. Yes, thank you so much for the presentations. Yeah, have some water.
Okay.
And the same procedure as last time. If anyone in the audience has a question, just pull up your hand and we'll see that your question has been answered, hopefully. But a first question here. From a management standpoint, is it hard to have 4 projects running at the same time, or how do you divide your focuses?
So, excuse me?
Yeah, from like a management standpoint, driving 4 projects at the same time.
Yeah.
Is it hard, or do you know extra focus on?
Yeah. So as our employees, the 17 employees we have in the research, only one of them are working on our development programs, and it's pretty obvious one person can handle all this. We will over the period. We need a chief medical officer coming in. We will also need some in clinical operation to manage it, and we also need a clinical scientist, because we want to have biomarkers to our programs, which will create a lot of value in phase 1. Also I see we need some people in non-clinical development. And with non-clinical development, I mean a toxicologist and a CMC person, as a person who's understands the manufacturing. And we are looking for those people at full speed. And all these additional people, they are in our budget.
And are you looking for that type of people right now, or?
Oh, sorry?
Are you looking to fill those roles
right now?
Right now?
Yeah.
And looking a little bit about cash balance, you recently paid off a debt and also did a reverse of convertibles. How is your cash position?
So when we got the money in, when I started 3 years ago, we had 100 million in debt, and biotech companies should not have debt. And we have then paid it off regularly, so we were down at 60 million last year, and I think was further down at 40 over the summer, and so soon as we got these $28 million in, we paid the rest.
Yep.
There is still a convertible of 6 million crowns, but that's compared to our daily volume, it will disappear by itself.
Yeah.
So I don't see it as a problem.
Yeah, of course. And you had a slide here earlier as well where you mentioned the Akada Pharmaceuticals collaboration. Can you talk a little bit about the details in the financial terms there? How will it affect the revenue model on?
Yeah, so we have told to the market mid-teens royalties. So they only get 2 countries, and they had to pay for phase 3 study. They also paid for the manufacturing of the product to be used in this phase 3 study. And we actually saved at that time 40 million crowns because we have used that material for our studies. So they had paid a lot around that, and they only got 2 small countries, in our view. So there's not a big milestone here. But it's coming in royalties, and these are in the mid-15s, 14-15% in royalties.
And talking about royalties, you recently got a milestone payment from Boehringer, if I'm correct, of 500,000 euro. You recently have a milestone payment from Boehringer of 500,000 euro pretty recently.
Yes.
Is it more payments coming your way in the near future, or?
Yeah, I mean, when we went into lead optimization in autumn, and you know, these big companies, they're very often they're very conservative, and when they selected, come and say now they're in lead optimization, they basically have the drug. But it takes another 12 months. So I think that that's a good chance we will see a candidate selection milestone within coming year.
Yeah, thank you. And we have a question for the audience here.
Yes. Hello, Thomas. Nice to see you again. Just a question about tesofensine. It's sort of been this never-ending story for many years now, and it was even taken off the evaluation from some of the corporate firms for a while. But now it seems like it's getting there. But could you somehow tell us, if you know, what has been the problem? Is it something intricate in the substance itself that will be difficult also in other countries, or did medics not do their job properly, or is the medical authority in Mexico somewhat strange?
Right. So I mean, it's I think medics is doing a quite good job. It has been very challenging in Mexico for several years. So we signed this deal with medics in 2016. And we had a phase 2b data at the time. They were supposed to do a phase 3 study. They did it. They had an agreement with COFEPRIS, the regulatory agency in Mexico, what it would take to get the drug approved. And then they talked about the phase 3 study, and they agreed to it. And then medics did it. And the idea is that they do this phase 3 study, and then they will do, after approval, another clinical study. And COFEPRIS bought into that, and then they moved on. In 2019, 18, I think end of 18, they finalized the phase 3, and then they prepared the package and filed in the end of 2019. And then COVID came. And of course, that was disturbing for the process. The regulatory agency was completely down. They were only looking at COVID drugs at the time. And that is an excuse. But it's not all of it. The problem with a country like Mexico, and for that matter, maybe also other South American countries, is that when there's a new election, then the whole management of the regulatory agency is changed. Not only the top one, but one layer down, 2 layer downs also. And there was a blue government when they started the phase 3, and it became a red government. So a complete change. And the president selected his friends, to be honest, and not necessarily because they were qualified. So COFEPRIS had not really qualified people for the last 4 or 5 years. And they had problems with corruption. When you have corruption, people get afraid. Even the honest people, they get afraid doing anything because then they are suspects. It was so bad, so the regulatory agency, the government started to make a legal route. So you could get a judge to get them to work. So it is not only medics who has problems with this. a lot of companies. I spoke with a third-party lawyer into this in order to understand the situation, and they're saying that their local people in Mexico, they are helping a lot of companies also through the legal route, because sometimes the coffee beans doesn't respond. So this is the situation, the environment they have been working with, and that has made it quite difficult. We are now at a point where I think that we have filed it 3 times now, and it was last time filed a month ago, and we think now there can't be anything more. And I think it's the last chance for them, coffee breweries, to solve it the regular way. Otherwise, it will go the legal way. So this is where we are. Okay.
Yeah, thank you very much. To summarize a little bit, why should investors take a closer look at Saniona as a next potential investment?
Once again.
Yeah, why should investors take a closer look at Saniona as a potential investment?
Why is it a good investment?
Yeah.
I think, right now, I think if you're interested in this company, I think it's a good time to step in. I think that the share price is down because of the TO4s. You can also participate. So it's probably the right time. It's a good investment because many biotech companies, Saniona has made a lot of deals over the years. I think we have made, since we started in 2013, we made 14, 15 deals. We made spin-outs. We have had experience in doing that. We are able to commercialize our science, and actually we have made a profit when we have in this period when we are focused on that. Despite that, it's early programs, and I don't think you find any other company in Swedish biotech who has done so many deals and have been able to do that. So this is one thing. The other thing is that we have a very strong pipeline now. It has never been as strong as we have it now. We have built the pipeline up over the years while we're doing all these deals, but I've never had a situation where we have so many assets and so high quality assets. And some of them are early, but still we have attraction on some of those early assets also, because they are so unique. They are what you would call it differentiated for the competition. They can do something else than the competing products. So this is what I will say.
Thank you so much for the presentation and answering all questions here.
Okay, thank you.